Hi everyone, my name is Darian Badenas Basa, and for today, I'm gonna report about the Mandatory Infants and Children Health Immunization Act of 2011, Republic Act number 10152. Okay, the objectives is, at the end of the report, students are expected to identify the importance of child health immunization, be knowledgeable about RA number 10152, and identify the advantages and disadvantages of immunization. Proceed po tayo sa ating introduction. An act of expanding the coverage of the mandatory basic immunization program and providing a system in the determination of other types of vaccine preventable diseases, amending for the purpose Republic Act number 10152, otherwise known as the Mandatory Infants and Children Health Immunization Act of 2011. The expanded program on immunization, or API, was established in 1976 to ensure that infants or children and mothers have access to routinely recommend infant childhood vaccines. 6 vaccine preventable diseases were initially included in the API, which is the tuberculosis, poliomyelitis, diphtheria, tetanus, pertussis, and measles. In 1986, 21.3% fully immunized children less than 14 months of age based on the EPI Comprehensive Program Review. Okay. Start po tayo sa ating question, which is what is immunization? So, ano nga po ba ang tinatawag nating immunization? Ang immunization is the process whereby a person is made immune or resistant to an infectious disease, typically by the administration of vaccine. And vaccines stimulate the body's own immune system to protect the person against subsequent infection or diseases. So, yung pag tinurukan daw po tayo ng pang-immune, so, pag participate po tayo sa tinatawag nating immunization, ito po yung magsisilbing protection para po maiwasan po nating magkasakit at hindi po tayo ganong ma-expose sa mga infection or diseases po. So, immunization is a simple and effective way of protecting children from serious diseases. It not only helps protect individuals, it also protects the broader community by minimizing the spread of disease. And vaccines work by triggering the immune system to fight against certain diseases. Okay, next slide po tayo. Okay. What is RA number 10152? Ang 10152 ay batas kung saan ito po ay tinatawag nating Mandatory Infants and Children Health Immunization. So, tinalaga na po ito para mas lahat ng mga tao ay sumunod sa batas na to para mas malesen natin yung mga pagkakasakit ng mga bata. Kaya baby pa lang, binibigyan na sila ng pang-immune para po mas mabawasan yung mga batang nagkakasakit. It is an act providing for mandatory basic immunization services for infants and children, repealing for the purpose Presidential Decree number 996 as amended. Under Section 3 of RA 10152, the mandatory basic immunization for all infants and children covers diseases such as tuberculosis, diphtheria, tetanus and pertussis, poliomyelitis, measles, mumps, rubella or German measles, hepatitis B, and influenza type B. So, ito po yung mga common diseases na include ng pang-immune para mas maiwasan ng mga baby na magkaroon ng mga sakit na ganito. So, Section 1, this act shall be known as the Mandatory Infants and Children Health Immunization Act of 2011. So, Section 2, it is the Declaration of Policy. In accordance with Article 2, Section 15 of Constitution, it is hereby declared to be the policy of the state to take a proactive role in the preventive health care of infants and children. Towards this end, the state shall adopt a comprehensive mandatory and sustainable immunization program for vaccine-preventable diseases for all infants and children. So, ito, binanggit na po ito kanina na dun sa ating tanong na what is RA number 10152. Kung sa Section 3, dito po sinasabi kung ano yung coverage ng immunization. Ito yung mga diseases na kadalasang dapat maiwasan ng mga baby, kaya dapat silang ma-immunize. Okay. The mandatory basic immunization for all infants and children provided under this act shall cover the following vaccine-preventable diseases, such as the tuberculosis, diphtheria, tetanus and pertussis, poliomyelitis, measles, mumps, rubella or German measles, hepatitis B, H. influenza type B or HIV, and such other types as may be determined by the Secretary of Health in a department circular. So, may mga iba pang mga diseases na hindi pa include dito. So, bukod sa mga sakit na ito, may mga iba pang diseases na maaring maiwasan kapag nagpa-immunize pag baby pa lang. The mandatory basic immunizations shall be given for free at any government, hospital, or healthcare center to infants and children up to 5 years old. So, yung immunization ay free lang sa hospital or sa health center. Ito ay libre sa mga baby na kakaedad na 5 years old pababa. Hepatitis B vaccine shall be administered by any duly licensed physician, nurses, or midwife to an infants born in hospitals, health infirmaries, health centers, or lying-in centers with obstetrical and pediatric services, whether public or private, within 24 hours after birth, provided, however, that in cases of infants born in places other than the above, any duly licensed physician, nurse, or midwife who delivers or assists in the delivery of the newborn shall be responsible for administering the vaccine to the latter. Or provided further that for deliveries assisted by persons other than the healthcare professionals mentioned above, the infant should be brought to any available healthcare facility so as to be immunized against hepatitis B within 24 hours. So, yung mga baby pala, after sila ipanganak, na-immune na dapat sila or dapat ay naturukan na sila. So, yung kadalasan yung mga physician or mga midwife or nurses na kasama sa pagpapaanak sa baby, dapat sila yung mga responsible sa pag-administer ng vaccine after bago matapos yung 24 hours. So, dapat bago matapos yung 24 hours ay naturukan na yung baby ng pang-immune. So, dapat hindi na siya aabot ng 7 days, dapat naturukan na pala siya ng pang-immunize. Provided, and finally, that subsequent doses of hepatitis B vaccination shall be completed according to the recommended schedule of hepatitis B immunization, as may be provided in the implementing rules and regulations to be issued by the Department of Health or yung DOH. Proceed po tayo sa ating Section 4. So, Section 4, Education and Information Campaign. All healthcare practitioners or healthcare workers who are administering prenatal care shall educate all pregnant mothers on the importance of giving their infants the basic immunization services as well as any possible effects of immunization. The DOH, other government agencies, non-government organizations, professional and academic societies, and local government units shall make available appropriate information materials and shall have a system of its distribution to the public. Okay. Section 5. Obligation to inform. Any physician, nurse, midwife, nursing aide, or skilled birth attendant who delivers or assists in the delivery of a newborn shall prior to delivery inform parents or legal guardian of the newborn of the availability, nature, and benefits of immunization against hepatitis B and other vaccine-preventable diseases at birth. So, yung mga physician, nurse, midwife, nursing aide, or yung mga skilled birth attendant na nagpaanak sa mother, dapat sila rin yung nag-oobliga na magbigay ng mga informasyon about sa nature and mga benefits ng immunization na against sa hepatitis B and other vaccine-preventable diseases at birth. Okay. Section 6. Continuing education and training of health personnel. The DOH, with the assistance of local government units, professional societies, and non-governmental organizations, shall undertake a continuing information, education, and training program for all health personnel on the rationale and benefits of as well as modern procedures for immunization of infants and children against vaccine-preventable diseases. Section 7, ito yung appropriations. The amount necessary to carry out the implementation of this act shall be charged against the current year's appropriations for expanded program on immunization of the DOH. Thereafter, such sums as may be necessary for the continued implementation of this act shall be included in the Annual General Appropriations Act. Okay, next slide. The Philippine Health Insurance Corporation, or PHIC, shall include the basic immunization services in its benefit package. Section 8, ito yung implementing rules and regulations. The DOH, in consultation with the National Immunization Committee, shall issue the implementing rules and regulations within 90 days after the approval of this act. Section 9, separability clause. If for any reason, any part of provision of this act shall be declared unconstitutional or invalid, the remaining provisions thereof which are not affected thereby shall continue to be in full force and effect. Section 10, repealing clause. All laws, decrees, executive orders, rules and regulations or parts thereof which are inconsistent with this act are hereby repealed, amended, or modified accordingly. Okay, ito po yung last section which is yung tinatawag nating effectivity. This act shall take effect 15 days after its publication in the official gazette or in at least 2 newspapers of general circulations. This law, or the Republic Act number 10152, was approved by SGD Feliciano Belmonte Jr. He is the Speaker of the House of Representatives. And the next one is si SGD Juan Ponce Enrile, which is the President of the Senate. And this act, which is a consolidation of Senate Bill number 138 and House Bill number 4393 was finally passed by the Senate and the House of Representatives on June 8, 2011. Isa sa mga nag-approve nito ay si SGD Marilyn B. Barwayap, Secretary General House of Representatives, and SGD Emma Lereo Reyes, which she is the Secretary of the Senate. And on June 21, 2011, this act was approved by SGD Benigno Simeon C. Aquino III, which is the President of the Philippines. So, there you go. References ko. Ayun. So, that's all. Thank you. Do you have any other questions before we go on? No? Okay. We have here the short quiz. Ayan. Just get 1/4 sheet of paper and then let's proceed po sa ating next slides. Meron po tayo ditong choose the best answer on each number below. So, multiple choices po yan siya lahat. 1, 2, 3, 4, 5. At lahat ng mga sagot po dito ay makukuha nyo lang din sa report po natin. Sumunod po natin, quiz natin ay, quiz number 2. Just write false if the statement was wrong and fact if the statement is right. So, ayan lang po. 1, 2, 3, 4, 5. Okay. So, yun lang po. Thank you. I hope may natutunan po kayo sa aking report. At yung PDF po ng report ko ay isasend ko lang din po sa ating GC. So, yun lang po. Thank you and God bless po.